Hey, everybody, and welcome to our channel. Yeah, right?
Mhm.
I'm Talia West Berkfeld. I have been in the insurance industry for over a decade. I have done everything from life insurance to group policies. I have started a agency before and trained over 400 agents on how to grow a book of business and keep that book of business for many years. So I consider myself an expert. Many do too. And that's why I started this channel so I could help people navigate the world of health and life insurance.
And
And
this,
here is my lovely co-host,
my name is Bettina
Bettina.
White. I have been in the industry myself as well for since 2016. We'll just put it that way. I have worked from captive agency to being a broker, to building teams, to training, to bringing products on board. Like I said, I've done a little bit of it all. I love what I do. I love being able to help people. I like telling my clients and being able to point them in the right direction and allowing them to be able to utilize and maximize their benefits in this crazy world of insurance.
It is a crazy place, but now you have two great agents on your side who will help navigate you through anything you need. And today we're going to dive into a topic that we'll probably talk about the most on our channel, which is going to be health insurance. It can often feel like this giant, crazy puzzle because it is. The system was designed to work that way. Um, but here we are to help you figure out this puzzle.
Yes. And the funny thing about it is, it's like one of those adulting things that nobody really teaches you in school, right? But don't worry, because I hope by the end of this video, you'll feel much more confident and empowered. We are going to unlock the secrets of health insurance, hear from some industry experts, and even take a peek into the future of what healthcare coverage will look like.
Yeah, throughout the course of this channel, we're going to spotlight insurance agents that we've worked with, carriers that we've made connections with. But today, we are your experts.
Yes.
So grab a notepad, get super comfortable, and let's get to demystifying the crazy world that is health insurance.
Yes.
Things first. Let's break down the absolute basics, right? If you don't have an understanding of the basics, you'll never have a real understanding of how insurance works. So, what exactly is health insurance? Well, it's a contract between you and a company stating that you're going to pay a specific premium in turn for them covering certain medical bills. They agree to pay this portion, and this contract protects you from financial ruin, pretty much. Right, Bettina?
Absolutely. Absolutely. And of course, it's designed to help potentially, vary you from the potential massive financial burden that healthcare uh, expenses can, give you if not used appropriately. But I wanted to talk about some terms that you will encounter, very common terms.
Sure.
Deductible, copayment, coinsurance, right? A deductible is amount that you have to pay out of pocket for your healthcare services before your insurance starts to pay. For example, if you have $1,000 deductible, you'll pay for the first $1,000 of your medical bills yourself. After you've met that deductible, then your insurance will kick in, and then you're in this part where you utilize your co-insurance, which is where the insurance typically pays 80% of your claims until you hit your max out of pocket. This is the absolute ceiling of the amount of financial responsibility that you will have for that policy year.
Exactly. I mean, that's where co-payments and co-insurance come into play. So let's think about this. A co-payment is a fixed amount for you to see a doctor, right?
Mm-hmm.
So I always explain this to my clients as like, remember when you were younger and you used to go out to these clubs and they would charge you, $20 to get in. But then you
Mm-hmm.
would get in and you would still have to pay for all of the stuff that happens inside of that club. It's the same kind of idea. So, if you go into the doctor and they happen to be a full service doctor and they do the lab work there, you will then be billed for the labs, right?
Right.
The
Mhm.
visit for the doctor is covered inside of that copay. It's
Right.
predictable and it's pretty simple.
And it's really just like when you go to a club or a nightclub or anything like that, the charge that you pay at the door, the cover
Mhm.
charge as they call it, that just gets you in the door. So that basically says, okay, I can come in here tonight.
Yeah,
Uh,
almost like I'm good for this. Now the
yes,
the the copay is never going to affect your deductible. So once you pay that copay, that's all it is. It's just a copay. It doesn't reduce your deductible.
correct.
So then co-insurance, right? Because everyone is like, well, what is co-insurance? Co-insurance, on the other hand, is a percentage. So once you've reached that deductible for your health insurance, your co-insurance kicks in. And now you're paying, let's say, 20% of every claim until you reach that max out of pocket, and the
Right.
insurance is paying 80. So let's say, it's crucial to understand these terms because they're used kind of interchangeably. So let's say you have $1,000 deductible to piggyback off of yours. You reach that $1,000 deductible. Let's say you have an additional $1,000 max out of pocket, and your total max out of pocket is 2,000, right?
Mm-hmm.
So for that gap in the middle, that $1,000, you're going to pay 20% of every claim until you reach that ceiling of total $2,000 all in that policy.
Right.
So these terms directly impact how much you end up spending on healthcare throughout the year. That key concept is that out of pocket maximum, because that's going to tell you what your all in on that policy is.
Right.
Once you've spent on the deductible, co-payments, and your insurance then kicks in 100% of the cost for the rest of that policy year. This is
Mm-hmm.
a critical feature because it can prevent you from experiencing, a catastrophic medical expense. And you want to think of it as your financial safety net for medical bills.
Absolutely. And of course, this can all be overwhelming. And yes, here is something to have to consider as well. There are several types of plans:
That, yeah.
HMO, EPOs, EPOs, POS. No, that does not stand for what you think of, but that's how I like to view it because, for the most part, anything other than a PPO is garbage, in my opinion. Health HMO or health maintenance organizations usually require you to use certain doctors and hospitals and specialists within their network. And you also have to get a referral to see a specialist from your primary care. Okay.
Hmm.
PPOs, which are obviously the more preferred network, stands for Preferred Provider Organization, which offers more flexibility. You can see both in and out of network doctors, and you don't have to have a referral. But your costs will be lower and you get a better discount if you stay in network, which is also bigger than your traditional HMO network, which requires you to stay in a very small window. You know what I'm saying? Uh,
Yeah, like, and don't get it wrong, like, cash is king. If you're at a network somewhere, you can always cash pay for that. But having an insurance policy is going to guarantee you a ceiling on what you're going to pay in. Or
mhm.
you can opt in for additional benefits like accident plans, cancer plans, critical illness plans. Our personal favorite, the fixed indemnity, which you typically have zero out of pocket costs when you get on one of those.
Mhm.
Hmm.
Yes. And understanding, the difference between these plan types is very important to finding one that not only fits your lifestyle, but your healthcare needs. Ask
Right.
yourself this question: do you want more flexibility and freedom to choose your doctors, or are you comfortable staying within a specific network just to save a little bit of money? Or can you get medically underwritten and have upfront benefits like no deductible?
Right. We enroll a lot of people in those kinds of plans, cuz all across social media all you hear is people like, I'm paying $1,300 a month and I have still all these medical bills I have to pay. Like, what's the point?
Right,
Correct. What is the point if you have this deductible?
right.
So you could pick plans that have no deductibles, and are pretty much affordable monthly. I mean, now that we've covered the fundamentals, I wanted to bring some deeper insight into what we're talking about. Having been in the industry for so long, I can confidently say, without a doubt, the single biggest mistake people often make is deciding what kind of plan based on the monthly premium.
Mm-hmm.
Now, don't get me wrong. I'm not saying you should get the most expensive monthly premium to cover everything. No, because you're always going to have a deductible on certain plans, right?
Right.
Um, a low premium might seem pretty attractive, but it could come with a very high deductible. And
Mm-hmm.
these days, we've seen high premium policies come with a high deductible as well. So sometimes it feels like you can't win.
Right.
Um, it's important to note that you can contact an agent. We typically have access to every kind of plan out there, including plans with $0 deductibles that have those upfront benefits.
Right.
Um, but you'll pay a lot more out of pocket with most plans before your insurance helps at all. So it's a total cost calculation, like adding up all of the premiums for a year.
Mm-hmm.
So let's say you pay $200 a month for the year. That's $2,400 just for to have the coverage. Now let's say you pay a $7,000 deductible. That's $9,400 in, right? Then you
Mm-hmm.
have an additional max out of pocket of 2. So then that is $11,400. Divide that by 12, you're almost talking about $1,000 a month for insurance, right? And
100%.
that's going to come with these unexpected things that happen. Um, but you have to consider the premium, the deductible, and your expected medical needs for the year in order to find the correct plan for your needs and budget.
Right, absolutely. And of course, this is a golden piece of advice, but something I wanted to add in there and I always give a diagram to explain to my clients is you get two baskets. One, you have a basket full of beautiful green apples that are all right, good to eat. You keep them in there, you keep them for a week, right? Then you get another apple and you've got four, five good apples, and then you have two bad apples, right? I like to compare the two, the green, all green apples, so it's a private plan, and the five good apples and the two bad apples as the public marketplace plans, whatever's offered. Because over time, those bad apples will um, ruin the good apples, which is why their rates skyrocket, and the green apples do not. So that's a great way to explain the difference between the two and why one increases whereas one does
Mhm.
not.
Yeah, I mean,
But
the
it,
ACA was created for people who have medical conditions to be able to get insurance. So you have maybe 10% of the people on the ACA are really supposed to be there. And then you have another 10% that are there for the subsidy. And 80% of the people are subsidizing the health insurance for everybody else, the sick and the needy, which is fine. That's what it exists for, right? But most people don't use health insurance like that.
right, absolutely. And so you have to look at the whole picture. I would also emphasize the importance of prevention, preventative care. Most people don't realize that insurance plans are required by law to cover a wide range of
Mhm.
preventative services at zero cost to you. This includes things like annual checkups, mammograms, pap smears, colonoscopies. Taking advantage of these benefits doesn't mean just keep you healthy. It can also prevent more serious and uh, health issues down the road, like it did with my dad a couple of years ago, where he was able to get in and get an early diagnosis and get treated quickly. Yes, it's one of
Mhm.
the most underutilized, yet most valuable parts of a health plan. So, my advice to you, obviously, is to make sure and check what preventative services you have and schedule those appointments.
Yeah, that's it. That's a great point to make. I mean, everybody in this industry does agree unequivocally on one thing: knowledge is power. And most agents won't tell you a lot of these things because they're interested in obtaining your business. So that's why we made this channel, was to tell
Mhm.
everybody everything you need to know that is insurance, because that's what we're here for. We love doing that and informing our customers
Right,
and our clients of that. We love talking to local community members about how we can save them money. I mean, the more you understand your own health needs and the details of your plan, the better you can navigate that system, because it's set up for you to pay the maximum amount possible, which is
right,
insanity. I mean, this is exactly why we started the channel, so we can navigate you through these messy, messy waters. So
right.
don't be afraid to call the number down below, leave us a message, um, email us, follow us on all our social media platforms. Follow and subscribe to this channel.
Mhm.
This is what we specialize in. And yes, we are experts. If some of these people out there on earth can call themselves experts, we by far can call ourselves experts.
100%.
Being a pro, yeah, we've been doing it long enough. We've probably, between the two of us, helped thousands of people.
100, yes.
You know, between our agents, between our agencies, our brokerages, we've helped thousands of people, even groups of 300 or more.
Mhm.
So, it's imperative to understand what you're getting yourself into when you're purchasing insurance, and make sure it works for you when you need it, because there's nothing like needing it and it not working. Like, I got a call about 9 o'clock the other night from a potential customer who was livid about an insurance policy he had, that they did not recognize it, they didn't take it, they didn't do this, they didn't do that, and they wouldn't see his child. First of all, I told him that's against the law. They can't turn you away because you can't pay, right?
Right,
And number two, offer to cash pay, and then we can navigate the back channels together. They're going to give you a cheaper rate, one, when you cash pay, which is wild to believe. But if you think about how insurance works, they file that claim. You've now paid the receptionist, you've paid
mhm,
the billing lady, you've paid the biller that's taken it in at the insurance company, you've paid the claims adjuster, and then you've paid the person that approved the claim to get it paid out, and the people in the mailroom to mail you your bill. So you are acquiring all those costs. You don't have to live that way, is the whole point.
right, absolutely. And another really exciting thing, and I love that we're able to help people and give them that piece of advice, right? Uh,
Yeah.
but what's really exciting is what the future holds for the medical insurance industry. We are on the brink of some really incredible transformations
Hmm.
driven by technology and a new focus on patient centered care. One of the biggest trends right now is the rise of telehealth. If
Yeah.
you don't
It's a
know what that
great thing. It's a
is,
great tool.
it is literally where you go in and you schedule an appointment and you have a virtual visit with a doctor. The past few years have accelerated this shift, making it easier than ever to see a doctor from the comfort of your own home. I have physically used it myself a ton. Bad weather hits, it's not safe to drive on the roads. Use Teledoc. I mean, it's so,
Yeah.
and you can use it for your whole family. So, you know,
The whole family's wiped out from a stomach virus.
I mean, all you need to do is just boom, boom,
Call.
it's done. And us insurers, and we, of course, part of that comes from the encouragement of technology and just how it being released. But they are embracing the virtual visit world, not just for convenience, but because it can also lead to earlier diagnosis and better management of chronic conditions. Imagine having a quick video call with a specialist who is 100 miles away, all covered by your insurance. And most of these benefits are free
No
to use.
copays.
No copays. Most of these are free to use and it's unlimited. So if you have a family of 5 or 6 and you have young kids, it's a great tool to use. It's It's no cost to you. A lot of times, that even the copay for your medicines are cheaper that way, and it's all covered by your insurance. The future is here for many of us. We don't even offer plans that do not offer this service.
That's true.
We do
Yeah.
not. It's amazing for families, saves money, and gets you the immediate coverage for the illness that you might have.
Yeah.
You know.
You have that peace of mind because, everyone likes to take little family trips. So even if you travel to the mountains, like this happened to us, we live in Florida. We traveled to Tennessee, and
Mm-hmm.
one of the kids got an ear infection. All I did was call telemedicine, and they called an antibiotic. And, and the next day she's much better, running around, enjoying the vacation. So telehealth is really, that was a great point you made, Bettina.
Yes.
I mean, another huge innovation that I am the most excited about is personalized insurance, right? Because everyone complains that it's not a one trick pony, not a one shoe fits all, square peg, round hole, all those analogies, right? But if you contact a broker like me and Bettina, we can help build you individualized plans that
Right.
are tailored to your needs. And companies are starting to use data from like those halo rings and smart watches, and they're intaking the data and they're showing you ways to save money, kind of like a safe driver that Nationwide has, or whatever the provider for those that has is.
Right.
So in turn it will help lower the premiums and incentivizes people to become more healthy, and then it'll lower the costs around the board. What's really great about it is it's turning into a sick care mode to a health care mode. And then you can grab individual policies. Like we have a association that offers that telemedicine service, discounts on radiology, discounts on dental, vision. What else? Prescription drugs, right? 1,000 of
Mm-hmm.
them, and hundreds of blood tests for a $7 draw fee, and it's
Right.
$79 for the family. Comes with guaranteed issue life insurance, guaranteed issue accident coverage, and that telehealth service for mental health as well. So it's all rolled into one package, and we're kind of the only people that have that right now.
Yes, absolutely. And speaking of mental health, we're actually seeing a greater emphasis on mental health coverage. And unfortunately, for too long, mental health has been treated as a crutch and separate from physical health care. Obviously, now that is finally breaking down, and insurers are recognizing that mental health well being is a fundamental to all health. Um, it's looking like future plans will likely offer more comprehensive and accessible mental health benefits, including therapy, counseling, and other support through digital apps. This is obviously a profoundly positive change that will help millions of people get the care that they need, and honestly deserve, to keep
Yeah.
their well being stable. Uh, it's unfortunate, and this is just a side note, that mental health has been treated the way it has, because in the world we live in today, it's like you get hit by 10,000 things, and it's not the same as when we grew up. So having,
No.
you know, the right treatment, and, getting ahead of it, it's just like your other medical chronic conditions. You want to get ahead of it before it gets bad, right?
Right.
Mental health should be treated no differently, you know. Uh,
Yeah. It is exciting to see that it's becoming a more broader subject for people to
mhm.
discuss openly and really pay attention to. And what's the greatest thing that's coming forward in the next couple of years is that our future is going to be all about transparency. So we work with plans that have been available for a long time that have websites you can visit that tell you how much the cost of, let's say, a knee replacement is. Imagine the availability of you being able to see, okay, well, hospital A charges $10,000 for this procedure, but hospital C charges 7,500. Well, I'm going to go over to hospital C and get that. Now, there's new regulations that are going to be passed, and consumer demand is really big for clearer pricing and simpler plan information. Um, we have tools that we use for our current customers and future customers that um, allow you to see the cost of a procedure, even lab work or x rays, CAT scans. You just put in CAT scan with contrast near me, and it'll show you the different prices, kind of like the Kelly Blue Book of health insurance.
Right.
Um, like you compare TVs or jet ski prices or boat prices or TV prices, you're going to be able
I
to.
mean, anything that you buy, cars. I mean, you're not gonna walk out the door before knowing what your car payment is.
Right, at all, but they expect you to do that with health insurance and not anymore. Agents have discussed this for many years.
Mhm.
Um, Customers have been demanding it for many years, and insurance companies need that kind of data from the doctors because what the heck is going on? Why is it different here than it is over there? There should be one clear price for everything, right? I mean, we've been selling products like this since I don't know the beginning. I started. They always
Yeah,
showed us
absolutely.
how you could look, you know. So this price transparency is going to empower the consumer to make more informed decisions and drive competition among facilities, among insurance companies, among us as agents. And it allows you to make informed decisions about your healthcare, taking it into your own control, controlling what wallet share that they get from you. I mean, the
Yes.
future of everything is going to be digital, but especially more so health insurance. You're going to be able to put claims in and see how much is going to be paid out to that claim. And we have policies that do that already. Some of our policies pay our customers back if the claim is less than what the insurance allows. So,
Mhm.
this more transparency across the board is going to give everybody more freedom and it's going to give everybody more power for over their health insurance.
Yes, and you look at it from our standpoint and you ask people, what are the two people that most consumers hate the most? And a lot of is car salesmen and insurance agents. And a lot
Yeah,
of it does not.
politicians and insurance agents is probably the more accurate quote now, right?
I mean, and it is, but some of it obviously is the obvious, but a lot of it, comes down to I guess they have this pre-notion that we are the ones that make control the premiums, and unfortunately we're not. But I wanted from a broader spectrum. Let's recap what we've learned. Um, we have broken down the core components of health insurance, like deductibles and copays. We've learned from experts who reminded us to look at the total cost of the plan, not just the premium, and to take full advantage of preventative care and tools like additional coverage plans to help with unexpected bills. And we've looked into ahead of the exciting future of what telehealth, personalized plans, and greater transparency will have and what it looks like going forward,
Yep.
on our medical plans, you know?
Yeah, and it's definitely a lot of information to intake in one video. So that's why we are starting this channel. And this is our introduction to the world, I guess. We'll have guests, people on that have worked in and out of the industry for many years, including carriers that agents that have been top producers, and agents that have huge books of business for many years.
Hmm.
We'll even have some people who have written policies that are going to be on the forefront of these innovations we've been talking about. So it's very exciting for us. And we just want you to feel more capable and less intimidated when you're trying to use your insurance. We want you to have a burden released from you. So, health insurance is a tool. And just like any tool, it's best when you know how to use it. So, by investing a little time to understand your plan, you're investing in your health and your financial security. So that's what we're here for you to ask any questions to, reach out to, call us, message us, email us.
Yeah,
We'll answer the phone.
absolutely. And like I said, we've got a combined of over 20 years experience, thousands of situations between the two of us. And so, there's very few, when I talk to a client, there's very few plans that I haven't heard of. Um, for fact, I could probably count
Mm,
on less than both my hands in the entirety, let's say probably the last uh, 4 to 5 years, the planes that I don't know about, because we've seen them all. But we wanted to thank you for spending this time with us today. We hope you found this breakdown helpful and feel more empowered to take control of your healthcare journey. If you have any questions, please drop them in the comments below. We will do our best to answer them. We will have our link, our phone numbers, emails, all that in underneath. And we are here to help you and empower you.
yeah, so thank you again for tuning in today. And if you enjoyed this video, which who enjoys health insurance? Not many people, but maybe you found the information helpful.
Mhm.
Please hit that like button. Consider subscribing to our channel, which would be great. Share our information around, message us, call us. It really helps us out. It makes us feel like we have a purpose here.
Yeah.
So stay healthy, stay informed, and we'll see you in our video next week, world. Bye.